So in 2026, we are going to make those doctor's appointments that we've been procrastinating on. Yeah, you and me both. And so if you have some fairly good to decent to good insurance, I say let's take advantage of it this year and let's start checking these lists off. Now, I wanted to make this as a second video because you don't have to go to so many different doctors to get these different things done. And I wanted to break down the different things, what the meanings of different things are. So this could be a fairly long video. Save this video when you're thinking about making your doctor's appointments and seeing what all is the most important to you. So top of the list is going to be a primary care physician, a PCP, internal medicine. So this doctor covers most of the list. Okay, and I just want to break down what all you can get done at this one doctor. Full physical exam, that's head to toe health assessment. Blood pressure check, screens for hypertension, very important for Black women. Heart health evaluation, checks for cardiovascular risk factors, depression, anxiety screening, mental health baseline. Okay, you can go there to this particular doctor also to get your annual blood work done. CBC, complete blood count. Checks for to see if you're anemic, infection, immune health. Okay, and then we have what's called CMP. I've broken it down so that I can also learn to comprehensive metabolic panel. That's liver, kidney, and electrolytes. See, if you start caring about all your different body parts, I feel like it's less likely that down the line something could go wrong with these body parts if you just kind of check in on them every now and then. We have A1C, that's a 3-month average blood sugar, diabetes risk, cholesterol panel, that's to check for heart disease risk, thyroid panel, which is a big deal, especially for Black women, metabolism, energy, and weight regulation, vitamin D, bone health, immunity, and mood, vitamin B12, nerve function, and energy. And then it's iron, check your iron levels and your iron storage. We have special screenings such as, this is the same doctor, blood pressure monitoring, long-term heart health, A1C diabetes screening, early detection, thyroid panel, hormone regulation, bone density baseline, bone structure, fracture risk, autoimmune screening, such as lupus, rheumatoid, I don't know if I said that correctly. I feel like I did though. Arthritis indicators. Lupus, maybe not a lot, but a lot of women get lupus, and they probably find out from random symptoms, which I'm not even sure of the symptoms of lupus, but just going in and getting the screening just to see if you have any signs of lupus or, all of these things that I'm talking about. I'm just using lupus as an example. So your primary care doctor can order most of this in one appointment. Okay, so don't look at the list and think this is a lot that I got to do. Don't think of it that way. And my favorite, next up on the list, is the OBGYN, which I have my girl in Houston that I need to be going to go see. I need to travel to see my girl. Because I've tried to go to other gynecologists through the years of living in other cities. And number one, I have to go to a Black woman. I've tried to go to other races of women, and they just do not do it for me. So my thing is, if you have a OBGYN that you love, I say stick with her. Even if you got to fly to make an appointment to go see her, I say stick with her, because one little slip up of somebody not checking something that they should can put you into some turmoil in the future. Okay. Women's health. What all is that? And I'm hoping that I'm reaching somebody that needs this, even if it's just one person. So we have a women's health. This is at the OBGYN. We're going to get the Pap smear plus HPV test. That's cervical cancer screening. Clinical breast exam, physical breast check, especially for Black women. I think Black women are the highest at risk for breast cancer. And when they do that when they do the breast check, they don't play. I'm telling you, they be all in it. They don't play with that. Mammogram baseline, 35 to 40 for a breast cancer early detection. We have this is at the gynecologist, STI screening. That's for sexual health. So if you've been out here doing your thing, having a good time, this is the time to get that full screening. And when you go, you need to get the full testing, not just those basic tests. We have reproductive health, pelvic exam. That's going to teach you what's going on with your uterus, your ovaries, your cervix. We have pelvic ultrasound. That's fibroids, detect fibroids, common in Black women. Fertility hormone panel. They got some acronyms that I'm not sure of. Back on. AMH. And they don't give me the definition. AMH, FSH, and LH. Ovarian reserve, fertility insight. We have birth control review, safety and hormone balance for women that you're going into getting on birth control or you're already on birth control. You can check out all of your options of birth control. There's tons and tons of options of birth control. Ovulation and cycle review, hormone health. So if you are concerned about what's going on with your body, with your cycle, you know, what's going on with your period, what's going on with your moods, or whatever it is throughout the month, and you need to get that checked, or you want to get that help, get that regulated, or see if what's going on with your body is normal, this is the time to speak up. And don't be scared of the doctor. I say when you go talk to the doctor, you need to be almost talking to them crazy. And I'm not really trying to say crazy, but you need to go in with your notes. Go in, do your research, have your questions written out when you need to talk to the doctor. When you're having these symptoms go on, you need to have it in your notes. This is what's happening to me right now. That way, when you go talk to the doctor and let's say that thing isn't happening anymore to you, you can still go get it checked out. Okay. So we have, so they don't just do pap smears. They monitor your hormones and your long-term reproductive health. So don't go into the gynecologist thinking they all you need is a pap smear and you're good to go. Like, you have tons of things. These people are getting paid the big bucks. Don't let them come in there and talk to you for 2 minutes and then deuce out. No, you got questions. You have questions. Especially if you're only going there once a year. I have questions, okay? Speak up. Speak up for yourself. This is your body. They can't tell you what's going on with your body. I mean, after seeing tests, sure. But in order for them to have the best test results for you, you need to speak up and tell them what's going on with your body, okay? I need to be quick with this. We got dentists every 6 months, non-negotiable. You need to go get your dental cleaning, okay? It removes plaque and it helps prevent against gum disease. We have oral cancer screening. They check for your gums, your jaw, and it checks your tongue. Dental x-rays, cavities, bone loss. Gum pocket measurement. Oh, I hate that so much. Oh my goodness. I hate that. That's when they stick your gums. Ugh. Inflammation and heart disease risk. Okay, you need to remember when you're don't just not go to the dentist because you think it's I know I don't have cavities, I'm good, or something like that. Like, literally your teeth are connected to your entire body. Remember that. Okay, so we got fillings check, decay prevention, decay prevention. Sorry, fluoride treatment, strengthens enamel. Okay. Your mouth is connected to your heart. Dental care is your medical care. I'm running out of time. All right, since I'm running out of time, I'm just going to start another video because I'm in the mood to talk about this right now because I'm like researching doctors that I would like to go to outside of the gyno because I have a gyno that I like, but I'm researching Black doctors because that's one thing that I've learned in my health and wellness journey. Like, I have to stick with the Black doctors.